Well, welcome back to our podcast. This is Moti Gambard here with Monica Westfall. We are in the beautiful San Clemente property, Southern California. Today is January 14th, 2021 on a Thursday afternoon. Enjoying the nice, beautiful day. How are you, Monica?
I'm good, Moti. Thank you.
So we're here in our actually new community in San Clemente. It's under construction. We're in the roof deck here. It's almost there, not quite there, but getting there. And you may hear all kind of noises in the background. The construction is happening as we recording this, just so as an FYI. If there is any disturbances, please excuse us, but we'll try to make this as smooth as possible. Monica and I were discussing, we're talking, bouncing back and forth ideas to what topic to discuss today, and I think we're going to talk about nursing.
Yep.
Nursing in long-term care facilities. What do you think about that?
Yep, I think that's a great idea.
So what do you think about nurses in a long-term care facility? First of all, is this a common thing or it's not a common thing? Is it good? Is it bad? What's the difference?
Well, skilled nursing facilities require nurses. When you get to residential care, boarding cares, assisted livings, they're not required. You know that. Licensing says you don't need them. However, they're a big beneficial factor to a resident's well-being. I mean, correct me if I'm wrong. You've been doing this for over 30 years, and you understand that the nursing aspect of it will help on all ends of making sure that medically the resident is maintained stable, right? So tell me, what have you guys done, or what did you do at RAYA'S all the years to maintain that?
I've had nurses for some time now, but before nurses, we used to have med techs, or our caregivers used to be trained on how to handle medications. But the downside to it is that, they're not clinically trained or experienced, so they go pretty much by what the bottle says, and there's just more room for error when you don't have somebody who's licensed, experienced administering medications. So I always prefer to have a licensed nurse on staff, whether it's an RN or LVN. In an assisted living facility, I don't think you really need an RN. I think LVN is sufficient. And for the podcast, LVN means licensed vocational nurse, and an RN means registered nurse. In a facility like assisted living, independent living, or even memory care, not skilled, I don't think we need I would not, put too much emphasis on a registered nurse. They're more for hospital settings and maybe doctor's offices, things like that. I know you came from a larger scale operations. I don't know if you guys had RNs or not, but
did in some and did in others we did not. You don't really need a registered nurse, as you're correct. You need them in the hospital, skilled nursing facilities, because sometimes skilled nursing facilities, they're doing feeding tubes and tracheostomy tubes. You don't see that inside of assisted living or independent. Independent, they don't even have nurses.
Yeah.
Assisted living, you do need a nurse. And I'll give you the most perfect, simple example. If you have a caregiver that is there to take care of your residents, and let's say the nighttime has come and there's a medication that needs to be given that specifically says to the caregiver, only give the medication, high blood pressure medication, example, only give the medication if the blood pressure is high. If it's not, then don't give the medication.
Yeah, but it usually indicates systolic over,
Correct.
160 or something.
However, it's a very common error that caregivers, because they don't have the training, they really don't. First of all, some of them don't even check for the blood pressure. And second, they're not reading the order correctly. So they just administer the medication. And then guess what? The blood pressure gets really high because you've now given, or low.
Low, the opposite.
Because now you've given a medication without actually following the order.
Yeah.
So simple things like that, you definitely need a nurse. In memory care, you need a nurse. For behavior reasons, what if you have a resident that is exhibiting behaviors? It's not always just give them a medication to sleep and have them pass out for the night. What happens the next day when they wake up and the behavior's back?
Yeah.
You need nursing for memory care and for assisted living for all aspects as the resident appropriately ages in place.
Yeah, well, it's also, sometimes the doctor will order something as a PRN as needed, and a lot of you'll give instructions like you mentioned about blood pressure, but there'll also be other things like sugar, insulin
Absolutely.
injection.
Absolutely.
I think injections can be only given by licensed nurses, RN or LVNs. So What do you do in the case if you don't have a nurse on staff and your client or resident requires insulin injection?
Well, if the resident is alert enough to be able to administer their own insulin, then they can do it. But if you're talking memory care and you have somebody that needs to be controlled with an injection, then you're kind of in trouble.
In trouble as to you're not allowed to do it?
No.
So you would probably depend on a home health nurse to come in.
You can. However, diabetes is a little tricky because if somebody is on a sliding scale, you need to be checking that at all meals.
That's
so
right.
what happens? You can't have home health come out 3 times a day. They're not going to do it. Medicare won't pay for that. So communities such as RAYA'S, we will have licensed nurses around the clock for many reasons.
Yeah, well, I think it's also for safety and quality of care. That's what we emphasize at RAYA'S here. So I think, I don't know, I would not, I cannot even explain or imagine running a facility without a nurse, especially if you have complicated cases, somebody with behavior or insulin or somebody who's hypertensive or I don't know.
There's
it's just
too much liability.
Too much liability, exactly, yeah. But, I actually... on the way, when I was driving from Los Angeles down here to this property in San Clemente, I was passing by a new building. I don't remember the name. It's a brand new building that apparently happens to house only memory care residents. Pretty large, probably around 100 beds. And I realized that they will not have a nurse on staff. So my question, if you specialize or if you build a building that is strictly for memory care, and obviously if it's memory care, somebody will have behaviors or things like, how will they be able to manage such building or such clientele with behaviors without a licensed nurse?
It's very simple. They can't accept the admission. They just won't be able to accept. So there's a lot of criteria that we both know that is set forth from Department of Social Services. So first of all, an assessment has to be done. And second of all, if the resident is exhibiting too many behaviors and you don't have a nurse, that you can't accept that resident, or they can't accept that resident. Second, if they're, need any type of injection, they can't accept that resident. You need a nurse with memory care and with assisted living for clinical aspects of things.
What about if they do medtechs?
Again, you're talking about a caregiver who was trained, gotten a simple caregiving, a simple training through licensing, and the training was, about 8 hours on medication, some of the do's and don'ts, but that's not clinical enough.
It's not the real thing.
No.
Yeah, so you would not feel comfortable placing or referring somebody who has any real clinical issues or behaviors issues to a residential care facility without a licensed nurse.
No, and you have a lot of families that will come through and say, my loved one doesn't need medical aspect, but eventually they will.
Yeah,
eventually they will.
So they cannot actually even age in place, because if you come in without anything and then you eventually do need something, then you need to most likely find a new place for them.
100%.
Yeah, 100%. So it's more for safety. Okay, well, is there anything else you would like to add?
The one thing, because we are here in San Clemente, just want to reiterate, if anybody's interested in having a tour, we are having a sneak peek on February 18th. It's from 9 to 3. Slots are almost filled up, so if family members interested or anybody's interested, please go to our website and place a phone call so you can reserve a spot.
Well, I think if we fill up the day, we can always open more days if there's a lot. We show that people are interested.
Yeah, well, we'll have more as we go along the process. So for now, this is our very first event that we're having. So
nice. Yeah, and actually, we'll keep you guys posted with these weekly podcasts about our next. Actually, not about our next podcast. Every podcast usually comes on a Tuesday or a Thursday, but when we getting close to open this community, we will have a big event, housewarming or open house, and we'll make sure everybody's aware of it, and everyone is welcome to come and see this beautiful building as it's coming along the coast with the beautiful ocean views. Well, thank you, Monica, for the podcast, and thank you guys for listening.